Good morning, everybody from the Pacific time zone. We are going to give just a minute for more people to log on, and then we will get started with today's presentation. All right, I will go ahead and get started. We open this presentation today by acknowledging that UCLA is a land grant institution, and here at UCLA, we pay tribute to the Gabrielino Tongva peoples as the traditional caretakers of the Los Angeles Basin and the South Channel Islands. Good morning, my name is AJ Scheitler, and I'm the director of the National Network of Health Surveys. We are a nationwide organization of both data custodians and population health data users who are interested in improving survey science and the utility of data. However, the workshops we are presenting today are not exclusive to surveys, so I don't want anybody to think you're in the wrong place. I'm going to ask all my panelists to mute yourself until it's your turn to talk. And for our audience, I'm going to ask that you use the chat function today for general comments and discussions and maybe some general questions. But if you have questions for the panelists, please utilize the Q&A function and we will queue those up to do a Q&A discussion session after our panelists have presented today. So, as I mentioned, the National Network of Health Surveys, we are working collaboratively with experts across the country to really improve the availability of data. And as part of that broader mission, we have been tasked with advancing the disaggregation of ethnic and racial data through technical assistance, training, and case making. And this is being supported by the Robert Wood Johnson Foundation, advancing their mission to advance a culture of health. And so this workshop series is part of the training and technical assistance that we are offering. We are looking to improve the collection, the processing, and the reporting of disaggregated racial and ethnic data that can then be used to address health disparities. And so we will have, as part of this, workshops that touch on all parts of the collection and dissemination process, as well as talking about how to understand, interpret, and analyze the data. We are going to provide, again, workshops, and if after the workshop you will go and give us feedback on the particular issues that you may be experiencing and want to address in your work, we will be offering technical assistance sessions to really do some hands-on helping. So please go fill out that post-workshop survey when we're done. These are the currently scheduled workshops. Our November 13th one was had to be postponed, and we will get a new date for that. The recordings of the first two sessions are on our website, and we have today's session and then 2 more planned, and we are also looking to add some potential additional sessions. So please check back with our website to get any updates on that. Today, we have the Central Time Zone well represented. We're going to be leading off with Dave Van Riper, who is at the University of Minnesota, and then Elizabeth Blomberg and Marjorie Givens, both from the University of Wisconsin, will be presenting. So while you get an idea of where they're from, we'd like to get more of an idea of where our audience is from, what you use the data for on a regular basis. So if I could get the poll put up. We have 3 questions in our poll today, so you won't see all of them at first, but if you'll scroll down and answer each of the questions, and then submit. We'll give everybody about 60 seconds to answer all 3 questions, just to give us a little bit better of an idea of who we're talking to today. T, if it looks like everybody has gotten a chance to put up all 3 of their answers, you want to go ahead and share the results?
Yes, they are still.
Okay, we'll give a few more seconds. Thanks. All right, if we want to go ahead and share the results now, that would be great. All right, looks like the Pacific, of course, is well represented, but we've got almost everywhere. Got some participation from all across the country. That's great. We have more consumers of data than producers on today, but certainly still a decent number of both. And research being one of the primary uses of the data. That is great. Thanks everybody for sharing that with us. So now I'm going to go ahead and stop sharing and give it over to Dave to get us started today.
Great, thank you, AJ. I'm going to go ahead and get my screen share started here. All right. Do you see that? Give me a thumbs up. Elizabeth, good? Okay.
We can see it.
There we go. Okay. So thank you. My name is David Van Riper. I'm the Director of Spatial Analysis at the Minnesota Population Center and the co-principal investigator of the National Historical Geographic Information System. And I'm here today to talk about changes that the Census Bureau is making to their disclosure avoidance process for the 2020 decennial census, or the proposed changes they're making, and what types of impacts that might have for public health analysis. Before I start, I want to acknowledge a few collaborators in this project. First, Steve Ruggles, Kathy Fitch, Tracy Kugler, and Jonathan Schrader are colleagues of mine at the Minnesota Population Center who have helped with this. Nicholas Scaff and Angela Werner at the Centers for Disease Control provided me with we're working on a paper together, and they provided me with some data on asthma emergency department visits that you'll see later on. And Glennon Barrison from the Massachusetts Department of Health provided me with some town level data on asthma ED visits. And we're going to show some age adjusted rates for that to show what the impact is of this disclosure avoidance change. So public health scientists and practitioners rely on decennial census data stratified by sex, age, race, and Hispanic ethnicity for states, counties, sub-county areas, cities, and neighborhoods to track a wide range of health outcomes. Decennial data, along with products benchmarked to them, such as the annual population estimates, provide crucial denominators for tracking disease prevalence, helping scientists identify at-risk populations for a wide variety of detrimental health outcomes, and provide information on social determinants of health. Poor quality denominator data will limit our ability to track trends in diseases over time, target interventions, and respond to public health crises, such as the COVID outbreak that we're all struggling to get through. For the 2020 decennial census, the Census Bureau is changing its disclosure avoidance system to provide stronger confidentiality protections for respondents. This new system, which is based on a technique called differential privacy, injects noise into nearly all published statistics. This noise injection necessarily makes statistics less accurate to provide enhanced confidentiality protections. Less accurate data, however, may hurt our ability to track health outcomes at various geographic levels and across a broad variety of subpopulations. In August of 2018, the Census Bureau came out with a plan announcing this change from their traditional disclosure avoidance techniques, which typically involves something called data swapping. They would identify households who had particular characteristics that would make them identifiable, and they would swap those households with fairly equivalent households in another geographic area in order to provide that confidentiality protection. In 2017, in 2018, the Bureau underwent what they called the database reconstruction and re-identification attack, where they reconstructed individual level data from the 2010 decennial census, linked it with commercially available data, and then checked to see whether or not those linkages could be used to re-identify individuals and infer the race and Hispanic ethnicity of those people. Through this attack, the Bureau was able to re-identify 17% of the 2010 decennial respondents through this process. And the census then argued that prior disclosure avoidance techniques did not provide enough privacy protection for individual respondents, and thus they needed to enhance their disclosure avoidance techniques. And to do that, they would adopt the gold standard, which is called differential privacy, which comes out of the cryptography and computer science literature. So in today's talk, I have two major things I want to talk about. One, I want to talk about how this differential privacy disclosure avoidance technique is going to be implemented. And then we're going to do a short bit on how these new techniques impact some of the denominator data that can be used in commonly done public health analyses. So how is differential privacy implemented? So to start, I'm going to use a toy example. I'm going to walk through a toy example of a pretend survey and show you how it works. And then we'll talk a little bit about the policy decisions that go into the implementation. So let's say we've got we've done a survey of 100 people, and it has two questions. One, it asks you to identify whether or not you are a male or a female, so you have a sex variable. And then it asks you to answer your school attendance level, whether you've never attended school, you're currently attending school, or you attended school in the past. So that's the true survey that's been done. We take those true survey results and we construct a cross tabulation from that survey. So here we can see that we have 3 males who have never attended school and 31 females who attended school in the past. The overall N of the survey is 100 people. Now, in order to implement differential privacy, what we do is we draw a statistical distribution and we take random values from that statistical distribution and we add that random noise to each cell in this cross tabulation. The way this is typically done is you draw a Laplace distribution for continuous variables or a double geometric distribution for integer based values. And you draw that distribution, and the spread of that distribution really defines how much noise can be injected into a particular cell. And that spread of that distribution is typically determined by a value called epsilon. And epsilon is going to be specified ahead of time by the analyst. And it is really independent of the cross tabulation. So the interpretation then of epsilon is it's kind of a relative measure of privacy. The smaller the value epsilon is, the more noise is going to be injected into the data. So if epsilon is small, you're going to inject more noise into the data. The higher epsilon gets, the less noise that's going to be injected into the data. So another way to think about this is that the smaller the value of epsilon, the respondents are going to be more private. There's going to be more privacy afforded to the respondents because the noise injection is going to be high. The higher the value of epsilon, the less privacy will be afforded to respondents because you're going to inject less noise into it. So essentially what you do is you define this distribution, you take random values, and you add those random values to the cross tabulation. So here you can see that for males never attended, we drew a random value of -1. So we add that to the value of 3, and we have 2 males who've never attended school. You'll see in most cases the peakedness of that distribution means a lot of the random values are fairly close to 0, but you have a tail risk. And for example, females who've never attended school, the true value was 4. The differentially private value has become 12. We've added 8 to that, all tripling that potential value, possibly making it more difficult to plan for building another school or for providing interventions for the people who were never attended school. We may put too many resources towards that true group, and so that is one of the risks you have with this type of disclosure avoidance technique. Now, I just talked about the value of epsilon, talked about how the analyst has to make that decision. And in fact, there's a ton of policy decisions that go into the implementation of differential privacy for disclosure avoidance. And I want to spend a little bit of time talking about those policy decisions to give you a sense of what types of decisions the Census Bureau is about to make in the not too distant future, and how that may have impacts on the published data that we're going to get over the next year. There's really 4 policy decisions that have to be made by the Census Bureau related to differential privacy. 1, what's the global privacy loss budget that they're going to use for 2020, the overall epsilon, and how are they going to spend that budget in fractional allocations to geographic levels and tables or cross tabulations. Finally, they have to decide what the invariants and constraints are, and 4th, they have to do post-processing to enforce the constraints and to make sure that we don't get any negative counts for units. You could tell there that you can draw negative values, and for small counts, you can get a negative outcome. So the global privacy loss budget represents the overall amount of epsilon that can be spent by the algorithm, and it can vary from 0 to infinity. An epsilon of 0 is perfect privacy and no accuracy. An epsilon of infinity is no privacy and perfect accuracy. And again, at the most basic level, the higher the value of epsilon, the more accurate the data will be. So thus far, the Census Bureau has not yet made a decision on what the global privacy loss budget will be for 2020, but they have been releasing some demonstration data products that have been applied to the 2010 decennial census data. And for those demonstration data products, they've used this overall global privacy loss budget of 6. Of that 6.0, 4 has been allocated to person tables, so tables by age, sex, race, and ethnicity, and whether or not you live in a household or group quarters. And 2.0 of that epsilon has been allocated to the housing tables, so occupancy, tenure, those types of variables. Now, to put this in context, this differential privacy came out of the computer science literature, and the theoretical computer science literature thinks that epsilons greater than 0.1 are too high. So we're orders of magnitude above that level, but the theoretical computer science literature has tended to work on kind of worst case scenarios and hasn't really looked at the real world applications to actual data sets. So once the global privacy loss budget is set, we can allocate those to particular geographic levels and particular queries or cross tabulations in order to privilege or make some of those geographic levels more accurate or less accurate than others. So for the demonstration data that have come out thus far, the Census Bureau has chosen to allocate the privacy loss budget in the following way. The nation and the state have received 20% each of the privacy loss budget. Counties, tract groups, census tracts, block groups, and census blocks have each received 12% of that privacy loss budget. This means that because nation and state get more privacy loss budget, we're going to inject a little bit less noise into those. Counties down to blocks are going to have more noise injected in them because they receive a smaller allocation of that privacy loss budget. But again, all of these are policy decisions that a group of individuals at the Census Bureau will make. They could choose to allocate these privacy loss budgets to other geographic levels, but in the demonstration data that we've seen thus far, this is what they've done. With respect to the allocation to queries, the Bureau has been making a lot of tweaks to this in the various data sets that they've put out. In a data set that was released last October, this was the allocation to queries. So the voting age by Hispanic, by race, by citizenship query received 50% of the privacy loss budget. And you can see down at the bottom, the sex by age queries for different age bins received 5% each. Now, again, this means that the voting age, Hispanic, race, citizenship kind of data will be more accurate because it's receiving a larger fraction of that privacy loss budget compared to the sex by age data. It's going to be less accurate because it's getting a smaller allocation of that privacy loss budget. Again, this is a policy decision that will be made by a group of individuals. Just to show you how that translates into a distribution. These are the Laplace distributions for some of these queries. So that peaked red line, the very tall one, that was the distribution of noise values added for the state level for the voting age by race by Hispanic citizenship data set. The slightly wider blue line is the distribution of noise values for the detailed query, which is the fully saturated cross-tabulation of age, sex, race, Hispanic ethnicity, group quarters or household status, and citizenship. And the wide green line at the bottom is the distribution of noise values added for sex by age query. So you can see at that green level, all of a sudden you've got the possibility of drawing noise values over 100. It's definitely possible, and we're doing billions and billions of random draws. So you have a chance of you have a high tail risk chance to inject a lot of noise into the data. On a parallel track, the Bureau has to choose invariants and constraints to implement. Invariants are counts that are not subject to noise injection. So these are counts that will be published as they were tabulated from the original data. As of today, the Bureau has not decided on a final set of invariants. In 2010, the list on the left were the decennial census invariants, so total population at the block level, all the way to voting age population at the block level. In the 2010 demonstration data products that we've seen thus far, the invariants have been very different. Total population has been invariant at the state level and nothing else, and that's for reapportionment purposes. At the block level, total housing unit counts, group quarters counts, and group quarters type counts have been invariant at the block level. So you can see there are some differences between those two data products. The invariants cause a lot of trouble with the post-processing routines that the Bureau is developing, and so they're trying to reduce the number of invariants as much as possible. Finally, they have the constraints that they have to impose, and there's really two main constraints. One is going to be non-negativity, so the Bureau will not publish negative counts for geographic units because you can't logically have negative people. And they also impose consistency. So consistency relates to the geographic hierarchy and the within table hierarchy. So county populations must sum to their state population, and the sum of males and females must equal the total population for a geographic unit. So the post-processing routine that the Bureau has developed imposes that. Finally, they have to go through post-processing that will eliminate those negative counts, impose those constraints, and impose those invariant counts. And this is an incredibly challenging problem for the Census Bureau to solve. They're using a non-negative least squares solution for that. The drawback to that is it leads to positive bias for small counts and negative bias for large counts. The Bureau has done a ton of work to improve their post-processing techniques, and they've done a fairly good job of that, making it making some of the data reducing the bias in particular, and making sure that they get more reasonable counts for total population. Okay, so let's see what this looks like when we actually do some analysis for some age disaggregated data for a couple of different geographic levels in the US. So we have three different data sets that we're going to look at. We have the original 2010 summary file 1 data set, and we have vintage 1 and vintage 2 of the demonstration data products. These are the only two products that we can use for this analysis because they have the age and sex structure that are needed to do age-adjusted rates. The Bureau has put out vintage 3, a vintage 4 data set, but those data only support analysis for the Public Law 94-171 redistricting application, and don't provide enough data broken down by age and sex and race to be used in this analysis. We're going to be comparing data from vintage 1 and 2 with data from summary file 1. Our summary file 1 counts essentially serve as our ground truth. Now, I'll acknowledge that the Census Bureau used prior disclosure avoidance techniques in summary file 1, the household swapping. And those techniques did introduce error into SF1, but the Bureau cannot publish the details about the swap rates. So we don't really know what impact it has on the tabulated data. And so we're just going to have to use those as our gold standard because that's the same data that all of us would have to analyze. We've already seen the geographic levels allocation. It was the same for both vintage 1 and vintage 2. The fractional allocations to queries were different between the two data sets. In vintage 1, the Bureau was really privileging the redistricting application. They were privileging voting age by Hispanic, by race, by citizenship, and then relationship to household or group quarters status variables. In vintage 2, they really tweaked their algorithm and they privileged total population. They wanted to make sure they got their total population counts as accurate as possible. Then voting age by Hispanic, by race, age by sex, by Hispanic, by race, so on and so forth. I've just highlighted some of the differences here. The other thing that the Bureau did is they made a massive change to their post-processing algorithm between vintage 1 and vintage 2 to try to address the bias issues that we were seeing, and you'll see some of the improved results from changing the post-processing algorithm. And I can talk about that in more detail later on if people have questions. So we've got we've computed some age-adjusted rates of asthma emergency department visits from 2010 for towns, all towns in the state of Massachusetts, and for counties in 25 states. These are states that contributed data to the CDC Environmental Public Health Tracking Program in 2010. And we use the 2000 standard population for doing our age-adjusted rates. And to compare the rates, we just took the percent difference. So we took the difference between the differentially private age-adjusted rate and the summary file 1 rate, divided that by the summary file 1 rate, and multiplied it by 100. And then we've done some box plots. We've then binned the town data and the county data by population size, and just done some box plots of those percent differences. So I want to walk you through that next. So this is the percent difference in age-adjusted ED visits in 2010 for Massachusetts towns. The red boxes are the percent differences from the vintage 1 data that was released in October of 2019. The blue boxes are the results from the May 2020 data release, that vintage 2. And so on the left-hand side, those are all towns that have fewer than 1,000 people within them. On the right-hand side, we have towns greater than 50,000 people within them. So like the city of Boston and the city of Worcester, Massachusetts. And as you can see, because the magnitude of the noise that is injected is independent of the count, we see that for smaller counts, for smaller towns, the noise is proportionally higher. And we see that for those, bins of less than 1,000 or 1 to 2,500 people, we see that the variation in the percent difference is quite high. So we have cases where, the median difference is about 0, right? It's close to 0, but we have quite a bit of range, quite a bit of variation around that 0 line, including some cases that are approaching 50% different between the two sources. You can see that vintage 2, the blue boxes tend to be a little bit more symmetrical. And around 0, the vintage 1 lines had a little bit of bias for a couple of the bins, but for the smaller bins, we still get quite a bit of variation. So that blue box for the less than 1,000 people is still quite wide relative to the red box. For large cities and towns, we see fairly low percent differences between the two data sets, and not a ton of variation. Here we have percent difference in the age-adjusted asthma ED rates in 2010 for US counties. And here we've binned counties by their rural-urban continuum code data. Variability in the percent difference is reduced when we use vintage 2 as our denominator, particularly for RUC codes 7, 8, and 9. Those are the most rural counties in the US. But we see a positive bias though in the output for that. You can see the bulk of those box plots, right? Almost 75% of the cases are above 0, indicating that the differentially private rate is higher than the summary file 1 rate. And we kind of see that, if you guys can't see it maybe as well, but a lot of those boxes for RUC 6, 7, 8, and 9, a bulk of the points are above the 0% difference line. So what's going on? Why are we seeing this in the output? It's really because the Census Bureau is still having trouble with sex by age and dealing with those counts. So here I've done a sex by age pyramid for a city here in Minnesota. It's Wayzata. It's a city of about 3,600 people in 2010. These are the single year of age by sex counts from summary file 1 in the blue and red plots. The black dots are the counts of single year of age by sex from the October data set, and the green triangles are the single year of age counts from the May 2020 data release. And what you can see here is you can see a lot of spikiness in some of those counts. So we've got counts in black where the black dots are on the 0 line. So the Census Bureau, the differentially private data is saying there were no females age 1, no males age 4, and then in the May data set they were saying that there was like 50 males age 4. So we're seeing a lot of variation in the counts. Now, single year of age data might be a bit fine-grained. What happens if we bin those into 5-year age bins? Well, we get an improved result, but we still get kind of a lot of spikiness in some of these counts. Look at that age 25 to 29 box plot, right? The differential, the true counts indicated about 100 males and females in that age range. In the October data set, the census, the differentially private counts were north of 200 for both males and females. And the May data set indicated a count of males almost double what the SF1 count was, and the female count was about 50% of what SF1 was. So we're still seeing a lot of spikiness in the data, and that's really going to mess with the denominators that you use in an age-adjusted analysis. And the way to think about this is, as you disaggregate data more, as you subdivide population into smaller and smaller bins, the magnitude of that noise injection is going to have a proportionally larger impact. So if we broke this down by sex, by age, by race, or by Hispanic ethnicity, we're going to subdivide the population up into smaller and smaller parts, inject noise into those counts, and that noise is going to have a proportionally larger impact, making it potentially more difficult to do these analyses. So in conclusion, we've got a little bit of a moving target. The Census Bureau is continuously changing their disclosure avoidance algorithm. They published new demonstration data on Monday, and I'm about to post that to a website, which I'll give you in a second this afternoon, so that you can go out and analyze the data yourself. I think public health analyses will be impacted. If you're studying subpopulations with small counts or geographic units with small counts, you really need to be aware of the potential impact that differential privacy may have on your data. And given that public health is moving in the direction of disaggregating data, right? They're trying to disaggregate data by age, by sex, by race, by other characteristics. This is going to have potential implications for those analyses. The final thing, and this is something we've been pushing the Census Bureau on, is that they have to help us quantify the uncertainty in these counts. They have to help us figure out what is the range of values around that point estimate, so that we can build that uncertainty into our analyses. So with that, I'm going to end. You've got my contact information. The bottom website here, nhs.org/privacy protected demonstration data, is where you can come to get summary files that we've computed from the Census Bureau's data, and you can analyze and use those data to see how it may impact the types of analyses you want to do. Thank you, and I'm excited to hear the next talk and to answer any questions people have.
Thank you so much, Dave. That was really excellent. If you wouldn't mind maybe throwing up the link to your analysis in the chat so that everybody can grab that, that would be wonderful. And now I invite Elizabeth to share her screen and get us started on the second part of our presentation.
Great, thank you. All right, so hopefully people are seeing my presentation. Can everyone see
it
that?
just fine.
Great, thank you. Okay, so thank you, AJ, and thank you, Dave. I personally learned a lot from that presentation, so that was great, thank you. My name is Elizabeth Blomberg, and I am a research scientist with the County Health Rankings and Roadmaps. I'm happy to be joined by my colleague, Marjorie Givens, the Deputy Director of Data and Science with the Rankings. And we're very honored to be here today and to be part of this great panel of workshops addressing health equity through data disaggregation. Okay. All right, so by the end of our time together today, we hope we will all be able to learn about the County Health Rankings and Roadmaps as a data to action consumer and producer, daylight considerations around norms and values in working with disaggregated data, share and learn together on ways we can navigate challenges. And so who are we? The County Health Rankings and Roadmaps program is based at the University of Wisconsin Population Health Institute and is a collaboration with the Robert Wood Johnson Foundation. And why do we do what we do? The County Health Rankings and Roadmaps has two primary overarching goals. The first is to improve health outcomes for all, which includes both how long people live as well as how healthy they are while they're alive. The second goal is to close the health gaps between those with the most and least opportunities for good health. Everyone should have a fair opportunity to be as healthy as possible, regardless of where we live or the circumstances we were born into. So what do we mean by health? Health is more than what happens at the doctor's office. As illustrated in our model here at the right, a wide range of factors influence how well and how long we live, from education and income, to what we eat and how we move, to the quality of our housing and the safety of our neighborhoods. For some people, these elements of a healthy life are readily available, while for others, the opportunities for healthy choices are significantly limited. We like to think of health outcomes like length and quality of life as today's health, while health factors like health behaviors, clinical care, social and economic factors, and the physical environment as tomorrow's health. And policies and programs impact these health factors and ultimately health outcomes. We often point to this image as one of our most important because it outlines what we use to determine the county health rankings and what influences health in a community. Because much of what affects our health happens beyond medical care, the rankings underscore how important it is to build a culture of health where getting healthy, staying healthy, and making sure our kids grow up healthy are top priorities. And what do we mean by health equity? Health equity is the notion that everyone has a fair and just opportunity to be healthy. Health equity requires action. We must remove obstacles to health, such as poverty, discrimination, and their consequences, including powerlessness. And we must create access to good jobs with fair pay, quality education and housing, safe environments, and quality healthcare for everyone. If we really want health outcomes to improve, taking steps to advance health equity has to be fundamental to our work. So we at the County Health Rankings and Roadmaps work to support communities to bring people together to look at the many factors that influence health, to select strategies that can improve health for all and close gaps, and make changes that will have a lasting impact. We do this by providing data, evidence, and guidance for communities. We also work to gather and share stories of communities around the country that are at different points on this journey to serve as examples and inspiration for you and your partners. Data is a resource that can be used all throughout the community health improvement process. It helps answer the question, what influences health? The county health rankings data can be used to assess the health of your community, be a tool for engaging communities in health improvement, help identify root causes of health issues, support decision-making and policy change, and track progress. You can find information for your state and county by clicking on your state on the map of our homepage, by entering your county name in the search bar below how healthy is your community, or in the main website search bar. So the County Health Rankings team draws upon the most reliable and valid measures available to compile the rankings. Our measures come from more than 20 national and state sources, such as the American Community Survey, the Behavioral Risk Factor Surveillance System, the National Center for Health Statistics, and many more. Since we do not engage in primary data collection, we are beholden to what is collected by these data sources. And we provide data snapshots for all 3,142 counties across the nation. When you look at your county snapshot, you can find your county's health factor and health outcomes rank and begin to explore the underlying measures of health to see which are strongest and which might need some work using our areas to explore and areas of strength tool. You can also compare your county's values to the state averages and top US performers, look at error margins to situate the reliability of the measures estimate, and look at trends in measures over time to track progress. You can also focus and dive deeper into your snapshot by examining the top causes of death in your county, our many additional contextual measures that we provide for each category, data disaggregated by race, ethnicity where possible, measure detail pages providing all relevant information on the measures, policies and programs informed by the evidence to improve health factors, as well as Spanish translations. So mentioned on the previous slide, we offer race-specific values for many measures in our data tables, and we continue working to add disaggregated data where we can. These values are available directly in the snapshot. For measures that have demographic data, the county value will appear in blue and be underlined, and it will be clickable. So when clicked, we provide data for, when clicked, a small table will appear, and we provide data for American Indian Alaska Native, Asian, Black, Hispanic, and white populations. However, not all counties will have data for all race ethnicities due to data limitations and sample sizes. We include only values that have an acceptable level of precision. So these are our current measures that have data breakdowns available as of our 2020 rankings by health outcomes and health factors. To reiterate, we are beholden to what the data sources from which we draw our data provide, which is why not all of our measures are able to be disaggregated by race and ethnicity. However, for each of our measures, we do provide resources on how our users can dig deeper into that space. And this is a screenshot from our website. So for instance, if we cannot provide the measure broken out by race categories, we point to other sources that might be able to provide similar data at that level. We document these resources for each measure for the categories of age, gender, race, education, income, and geographic sub-county area. Here's another screenshot from our website. So we provide pages with guides for how to dig deeper into the data and how to understand how health factors and outcomes can differ by many different characteristics and how that can help to inform community efforts to target resources where they're most needed. Within this resource is also a guide about getting started with data disaggregation and key lessons learned from 3 pilot projects to most effectively explore and evaluate data within counties, including conceptual development, analysis, data visualization, and positioning for sustainability. So that's a brief overview of only some of the many resources we provide on our website. And now I'd like to discuss some of the experiences we have had with accessing and using disaggregated racial and ethnic data. So we at the County Health Rankings and Roadmaps are both data users and data producers, and we've been on a data disaggregation learning curve since we began over a decade ago. We're certainly not alone in this space, and we're on a learning journey in these considerations to get to the best path in navigating challenges and considerations around norms and values for accessing, interpreting, manipulating, and communicating and displaying data, with no right answers for all situations. As a data platform that's both the user experience as well as feeding others who are the users, this is our unique experience. And so we're excited to share what we've learned as well as learn from others doing this work, including you. For instance, the group We All Count has a great guide in this space with a series on their data equity framework and how to keep equity in mind, from funding to motivation, project design, data collection and sourcing, analysis, interpretation, and finally communication and distribution. So I certainly encourage you to check out that great resource. And what specifically do we mean by norms and values in this space? Norms can be considered standard practices in measurement, such as using consistent definitions for racial ethnic categories or standard comparisons like using population averages. Values are the judgments that invariably underlie measurement, but in our experience are rarely acknowledged or spelled out. Some values inherent to data disaggregation considerations include which dimensions of identity are the most important to highlight. Does the choice of reference point reinforce social advantage? For instance, the implications of referring to the white population as the normal or ideal group. Also, when is a data point considered too unreliable to responsibly publish? What about when confidence intervals are not provided with point estimates? How do you balance providing users with reliable data with excluding certain groups from the conversations? And what do these issues say about your underlying values? So now let's think about the challenges and considerations of first accessing disaggregated data. At the County Health Rankings, we certainly prioritize accessing measures at the county level, and even data at this level of geography can be a struggle to find consistently across the nation from data sources. let alone data disaggregated below that level. So as mentioned previously, many of our data sources do not provide any type of disaggregation of their data below the county level. However, if disaggregation is available for a measure, it might differ for what type. Data could be available by race, ethnicity, socioeconomic status like education or income, geography, gender, disability status, and many more, and even multiple of these or combinations of them, but highly unlikely all such types of disaggregation. At the county health rankings, we draw from many different data sources, and we're trying to uniformly disaggregate by race, ethnicity, or these other subgroup types. And we find that the sources are sometimes making different choices about disaggregation. For example, we run into issues of how certain racial ethnic subgroups are defined. One data source may define Asian as Asian only, while another may define it as Asian or Pacific Islander. And we don't have control over these decisions being made. White may also be defined as non-Hispanic white or white including Hispanic ethnicity. Sources might also not even be explicitly clear about these definitions or how their subgroups are defined. So being as clear as possible about disaggregated subgroup definitions is an important step and should be done uniformly up front. Related to this is the reality of shifting demographics in our country. As our population diversifies, are our current definitions of race, ethnicity, gender, and other dimensions valid and representative? For instance, we're likely to have increased numbers of individuals reporting 2 or more races. So how can we best account for these shifting demographics and increase our specificity of subgroups without an extreme loss of data coverage? Finally, it's important to make clear the intention for seeking disaggregated data upfront so that intentions or interpretations are not misconstrued. So moving on to challenges and considerations for interpreting disaggregated data. With a number of considerations at play at once, and if norms and values from the originating data sources are unknown, decisions that were made at that step might be inherited or implied unintentionally. You may be imposing a value in your own data that you did not mean to because that decision was intentionally or unintentionally made by those who collected and published the data. For us at the County Health Rankings, we are at the interface of multiple different data platforms who may have different norms and values, and thus we need to figure out how to navigate these while staying true to our own norms and values. So this is certainly a challenge that we're still working on and struggling with. How also do we be explicit with disaggregated data about racism and structures that align with our values? We must acknowledge realities such as race ethnicity being a socially defined construct that can be misconstrued, oversimplified, or unintentionally place blame on individuals when systems and structures are really the issue. So as mentioned before, it's important to put these considerations and norms and values at the front before presenting data, because they will be implied if we aren't explicit about them. And finally, the context and the narrative is important for what messages come out of the data at the end of the day and what we can say about it. Thinking about the story we are telling and the narrative embedded in the data is important, especially around access and opportunity, since disaggregated data can be misinterpreted and lead to blaming individuals and groups for differential outcomes. So when manipulating disaggregated data, one of the biggest challenges is small sample sizes. Due to privacy constraints in the data source or simply low population numbers or small numerators, disaggregated data can be heavily missing from many places or subgroups. It's important in public health to have de-identified data so that no one's privacy is violated, but this can mean many races or education groups or small geographies cannot be reported on in many smaller places. Or even if the numerators are large enough to be reported, the estimates may still be based on such small numbers that the reliability of the estimates are called into question. So these challenges affect our ability to break out by as many subgroups as we would like to, balancing the wish for intersectional data with the reality of data power issues. It also leads to considerations such as whether or not to impute data for values that are missing, and if so, what methods to use to impute. And finally, confidence intervals are very important to give the context of statistical uncertainty and how much trust we should have in the point estimate, because point estimates alone can be misleading. So we provide confidence intervals where possible in the rankings, but several data sources do not provide them with their estimates. They may be missing directly in the data source, or we may need to calculate them ourselves if possible. Finally, challenges and considerations for communicating and displaying disaggregated data. Challenges can be how to visually display disaggregated data, such as with color spectrums. One issue we've run into before is the implication behind having a darker shade of color mean that the value is bad. Tying together the idea that dark or black is bad or that white is good is problematic and can lead to harmful messages that we want to avoid. It's also important to have no naked data and provide context and interpretation behind all disaggregated data, but this can also be difficult visually if space is limited. So one of our main considerations for disaggregated data we struggle with at the rankings is when to display or suppress data when estimates may be unreliable. Which estimates should we consider to be reliable and which we should not is often a difficult call to make. As much guidance from the primary data sources as possible would be really valuable in this space for consistency's sake. We want to balance the competing interests of supplying data as much as we can with worrying about the data we supply being unreliable and thus irresponsible to present. Finally, understanding your user's data fluency is important to display and communicate in a way that they can understand, that won't be overwhelming to new users, but also will provide enough information and depth for experienced users. Clear labeling and definitions of measures and subgroups is really important in this space. So now that we've walked through just some of the many challenges and considerations of accessing, interpreting, manipulating, and communicating and displaying disaggregated data, we thought we could walk through and apply these to an example scenario we encounter in the rankings. So let's talk about our measure of children in poverty in rural counties. Children in poverty is defined as the percentage of people under the age of 18 living in poverty and helps represent a very important aspect of health, the social and economic context for the most vulnerable of our population. Children who experience poverty also experience lasting effects on their academic achievement, health, income, and much more into adulthood. So this measure is an important factor to capture for as many places and subgroups as we can. However, the data source we use for our estimates of children in poverty, small area income and poverty estimates, doesn't provide disaggregated data by race ethnicity. And therefore, we need to obtain this breakdown from a different source, the Census's American Community Survey, for our racial breakdowns. Having different sources for our overall measure and our racial breakdowns isn't ideal, but we feel like having some context as to the disparities that exist by race ethnicity for this measure was more important. And even though we can disaggregate the measure by race, the data cannot be accessed by many other dimensions or facets that may play an important role in the rural context, such as gender, education level, or others. In manipulating this data once we access it, the biggest issue we run into is small sample sizes and reliability of the estimates. Rural areas can have very small population sizes and thus may have missing data for many measures and subgroups. Estimates get especially missing or uncertain when looking at communities of color in rural areas. As Dave talked to in his presentation, the measure of children in poverty is already subsetting the population to ages less than 18, and so this only increases the issue. As you can see in this graphic example, a largely rural state like Nebraska has children in poverty values missing for many races in many counties. Another issue here is the calculation of confidence intervals for the breakdowns. Since we need to aggregate multiple measures from the data source in order to calculate these subgroups, confidence intervals have to be calculated from adding a number of estimates together, which could potentially result in larger confidence intervals than necessary, which is a limitation of this breakdown. So for communicating and displaying these values, we've encountered issues with deciding what values to suppress. For instance, when is a value outside the likelihood of possibility? Extreme values like 0% poverty or 100% poverty are perhaps unlikely reasonable in reality and maybe should be suppressed. Or what about if only one racial subgroup has data available? Should that group be displayed by itself, or should all groups then be suppressed? Having only one subgroup present for disaggregated data isn't very helpful and can be misleading. And this is especially important in the rural context, where areas tend to have much less diversity. So this means that the values you can display and thus the stories you can tell may be inhibited. So how can we balance providing responsible and reliable data without completely excluding certain groups from the conversation? So finally, the interpretation of disaggregated racial, ethnic, children, and poverty data in the rural context. How can we provide context to the different values of poverty by race in a succinct way that doesn't perpetuate stereotypes or place blame, especially when values are as different as they are in the example here to the right? It's important to supplement disaggregated data such as these with messaging around community-wide structural issues rather than individual choices or behaviors. At the end of the day, our hope is to encourage critical and responsible consumption of data, including disaggregated data, while still understanding that data is powerful and important for the goal of improving health and increasing equity. So that wraps up our presentation portion, and we're really excited and interested to hear questions from all of you and ask you all questions so that we may be able to share and learn together in this space. As we've mentioned, we're also on this journey of understanding how to most successfully use disaggregated data for the goal of health equity. So we really want to learn from others as well. And thank you.
Wonderful. Thank you very much to both of our presenters today. These have been very excellent, very stimulating. And we do have some questions, so I'm going to go ahead and get started. The first ones are for Dave. Thinking back to your presentation, the questions are, what is the privacy loss budget and what is it used for specifically, and who are the recipients?
Okay, so the privacy loss budget is going to be set, and essentially it ranges from a value of essentially 0 up to infinity. And the larger that budget is, the more accurate the statistics will be. So in general, if the Census Bureau chooses a privacy loss budget of 20, the counts that will be published will be more accurate. If they choose a privacy loss budget of 1, the counts will be less accurate. There will be much more noise injected. So in general, the overall privacy loss budget, though, is not necessarily like you want it. In my opinion, you want it high because you want more accurate data. But then when they spend it, they allocate the privacy loss budget to one of 2 areas. Either they can allocate, they allocate it to different geographic levels, and geographic levels that receive a large fraction of the privacy loss budget will be more accurate, right? So the larger the fraction they get, the more accurate the data will be. And the Bureau can choose to allocate that in any different way. So they could say, we want to give 90% of the privacy loss budget to the nation. That's going to make the nation counts really, really accurate, but that reserves only 10% of the privacy loss budget for counties or census tracts or census blocks, making those counts less accurate. The same thing can be done for particular cross tabulations or queries. So the Bureau can say, hey, we really want sex by age counts to be very accurate. So we're going to allocate 80% of the privacy loss budget to sex by age. But that means if you make those more accurate, you are by definition going to make other queries less accurate. So if you privilege sex by age, the counts that are by race or by Hispanic ethnicity are going to be less accurate because they've gotten less of that privacy loss budget. So it's kind of like a slider where you're allocating privacy loss budget to different queries. And there's a committee in the Census Bureau that will have to sit down, and before they run their algorithm, they will affirmatively choose what those allocations look like. And they're taking feedback from users about, I use the data for this particular use case. And we really need accurate data for this use case on sex. And then other people are like, I need accurate race counts for application Y. And so the Bureau is getting tons of feedback, and there's only a fixed budget to go around. So if one thing gets more, something else is going to get less. And they're trying to do that balancing act right now.
Great, thank you. The second question is also for you, Dave. What are the implications for trend analysis, and how should we approach analyzing trends over time? Is the Census Bureau planning to release previous decennial census data products with the new differential privacy so that the estimates are comparable?
So they're not planning to release, to apply this mechanism to prior decennial censuses. And I think this is this trend analysis is going to be a problem for, especially if you were doing health analysis, right? Trying to look at change over time. You've done something. Are rates increasing or decreasing? It's a use case that the Bureau I don't think has spent a lot of time engaging with. They haven't spent a lot of time, as far as I know, talking to health people who do trend over time, change over time analysis. And I think this is where that being able to quantify the uncertainty is going to really become important. So we're going to want to be able to know, okay, if my age adjusted rate is 3, is that plus or minus 0.5 or plus or minus 1, to give a sense of what that range looks like. But I think change over time analysis is going to become more difficult under the new disclosure avoidance technique without a good sense of how to quantify that uncertainty.
Great, thank you. Elizabeth, the next question is for you. How has your team thought about and made decisions related to depicting data for the AAPI community when disaggregating within that community is not feasible? The second part of the question, I'm sorry, I think is missing a word, have learned that outcomes vary substantial within the AAPI community based on country of origin and other factors, but it's not always possible to disaggregate. How do you process the trade-offs if aggregate AAPI data paper over important community disparities?
Sure, thanks. And I'll kick this over to Marjorie if she has anything to add. It's a good question. And I think in general, we've tried to be as consistent as possible with whether we are capturing the Asian population or the Asian and Pacific Islander population, where we can know that, documenting which it is, and even possibly breaking it down between 2 different groups within that group if possible. And I think that it really goes back to balancing, trying to accurately capture this population, as well as not, and accurately capturing them and providing data for that group without incorrectly representing them if we do not have that data. And so I think we lean more towards making sure the data is reliable. We don't want to say something about subgroups or populations that we don't trust to be true and that we can't, that we don't feel like we can reliably report. And I'll kick it over to Marjorie if she has anything to add.
Yeah, thank you, Elizabeth. I would just echo what you're saying and offer that I think the issue of within group variation is something that is true for pretty much all of the groups that we disaggregate, and that it's something that we aim to acknowledge in any disaggregation effort, that there is yet more nuance within that group, whether it's another racial ethnic group or by age or what have you. And so that's where, as Elizabeth was saying in her presentation, the idea of no naked data and being able to provide context and acknowledge assumptions around data collection and norms and values when presenting information.
So for researchers who want to work with the most disaggregated data available, where can those data sets be found, and where can the methodological guidance around treating those data be found? Anyone? Ideas, thoughts?
Well, I feel like that is a ginormous question, an incredibly important one, and it really depends on the focus of the research, and really, I think it's the intent, the research question behind it. I think it also goes to something that Elizabeth lifted up in her talk. You need to have purpose in the research question you're asking of the data, that you need to go in with it with a true understanding of what your underlying hypotheses are, your norms and values that you're bringing to the research process to think about that, and that you need to have those clearly articulated in your own mind as you think about the data sources that will best help you answer the research question that is priority to you. In terms of resources to help you surface those norms and values at the fore, Elizabeth offered one with We All Count, but there are several others that are out there. It is absolutely phenomenal, in my opinion, that the the guidance around decolonizing data has really continued to come forward in what's available for us as practitioners and researchers to really be more intentional with our use of data. And I'll invite my colleagues to jump in here as well.
Okay, so the next question is for Dave. So is it accurate to say that the privacy loss budget is a number that represents the amount of noise that will be added to the census data?
Yes, in aggregate, right? So it's hard to say, right? So the unfortunately, the way that they allocate the privacy loss budget is actually almost as important as the overall privacy loss budget. So yes, the larger that is, the less noise that's going to get injected into the data in aggregate. But the way they subdivide it up means that they could, if they allocate a very small fraction of the privacy loss budget to a particular geographic level or a particular query, that is going to get like more noise injected into it, but it's going to be a smaller amount of noise if that privacy loss. So 2% of 20 is a relatively big value compared to 2% of 1, right? So you've got to look at those fractions. That's going to be the more important piece. But in general, yes, it kind of in aggregate, it's the noise that's going to get injected into the data.
Thank you. Dave, also, can you clarify if the data is accessed from the research data centers, will it be the actual or the differential privacy data?
So if you are in the Federal Statistical Research Data Center, you will actually be getting access to the private count, the unperturbed data will be available within the FSRDC for your analysis. If you are going to want to bring anything out from your analysis out of the FSRDC, you will have to inject noise into those counts. And what's going to happen, and this is something we don't know about yet, is that the Census Bureau will give you some chunk of that privacy loss budget for your particular study. And then that's what will control the amount of noise that will get injected into either the counts that you want to bring out, or the regression coefficients or the model coefficients that you want to bring out. Right now, we don't know how individual researchers will get allocated different amounts of that privacy loss budget. So that is an unknown yet, and the Census Bureau has not provided any guidance yet about what that's going to look like. But you will have access to the unperturbed data within the RDC.
The next question is back to Elizabeth. What metric do you use for the, quote, acceptable level of precision?
That's a great question, and it really depends on the measure. Often the data source might provide some guidance on that, whether it is they might suppress under a certain numerator. Sometimes they might suggest to suppress under a relative standard error of 0.25. It really depends measure to measure because our measures differ. We have some rates, we have some percentages, we have some indices. So we do provide guidance on our website as to where we suppress, how we suppress, and those sorts of things. And we also sometimes turn to the literature. If a measure, life expectancy, for instance, if a measure we want more guidance on how we should suppress, what is considered reliable. So yeah, it really depends on the measure, and we try to provide as much documentation as possible on our website for the decisions we make and why we make them.
Great, thank you.
I don't know if we're allowed to ask questions back to those who are participating, but this is actually something that we really struggle with, the primary and secondary suppression of data and the ability to bring forward the most information that's possible while doing it with responsibility. In other words, allow people to be part of the story when you're dissecting identities, but do it with care and caution. And so I'd really be interested in hearing from those who are joining us, how are you thinking about data suppression issues, primary, secondary, and what criteria have you used or that you might share with us that we could learn from in your journey in this space?
Yeah, if anyone has some information they'd like to share, please put it in the chat box and we will read that and share with everybody. While we are giving people time to do that, we have a question for all of the panelists. Health disparities research is a somewhat new discipline of science. What do you think are the priority areas in data science for health disparities research?
I think one is something that we struggle with in all of these domains is just developing that common set of descriptors for the data, right? So what do we mean when we what are the categories that we are wanting to collect data in? Can we develop a consistent set of metadata and codes that we can, consistently capture from health system to health system? Or can we build usable crosswalks that, you can use to, directly compare data collected from entity to entity? And I think that is always going to be an issue that we face in lots of different research, but I think in health disparities research, it's going to be an issue. One of the things I struggle with in some of my academic research is Hispanic an ethnicity or is it a race? And a lot of the different health systems collect that particular piece of information differently. It's a race category in one group's EMR, and it's an ethnicity category in another group's EMR, and trying to reconcile that's incredibly challenging.
Yeah, I would definitely echo what Dave is saying. And on a similar note, I think it would be really powerful as a field to come to a consensus on what we mean by health equity, how we define it, having a framework for health equity that we can all work on that hopefully would apply in many situations, and having a guideline and consensus around measurement of health disparities and health equity, because it can capturing these things can differ so much on how you measure it, what metrics you use, what comparisons you use. And so having more of a framework to build off of for that, so that at least we know how the decisions we're making around measurement affect ultimately our results and how to track progress over time. And yeah, like Dave said, how we measure certain groups. And I think the idea of intersectionality is really important here, that drilling down as much as we can get to different identities and different groups to really understand how our systems and structures are affecting as specific of groups as possible is really important. But again, it goes back to this idea of data power, and can we accurately capture that?
And I don't have anything new to add, rather just to underscore that I think measuring disparities is with the intention of understanding how we make progress towards health equity. And so the more we can be transparent about what that means to us and how we are using data responsibly to get there, I think as a field, we will all benefit.
So again, a question for all of you. For those of us who investigate methods for understanding health equity, ways to best measure and present, it is useful to have disaggregated data that allows us to understand what works better for different purposes. Are there methods, working groups for building less siloed research questions by research question approaches? Are any of you aware of any work being done in that area?
You all have been a go-to. So thank you for creating this space. I think it's one of the ones I've seen over time that has been very helpful for these open conversations.
Let's see. All right, so we did get some feedback, Marjorie, to the question that you put out there. me go back to try to get to the first one. Megan Randall is here on behalf of the Racial Equity Analytics team at the Urban Institute. Welcome, Megan. We are a young initiative, but have been trying to provide and visualize indicators disaggregated by race and ethnicity for the census pulse data. We don't suppress data, but we have experimented visually with depicting disparities that are statistically significant or not. And she includes a link in the chat to their to the site where they're putting that up. She says our comms team worked very closely with us to try and figure out a clear way to display those results. We hope it is effective, but it is by no means an easy question. There were and are many trade-offs that they considered. Thank you very much, Megan, for sharing that.
Thank you, Megan.
Apologies if I butcher the name. Monel Schroff writes that we are struggling about when to suppress data, currently using a yardstick of lower than 2% of the total sample. Not sure if this is something others are using. Some groups are using an absolute number of less than 6, but that seems too conservative as it depends on how big the full sample is. Do you have a reaction to that? What yardsticks do you use, or does it float again depending on what the sample source is?
Yeah, so I guess I would offer, again, we don't think there's a right answer necessarily, but one needs to be mindful of the choice they're making. And so I really appreciate understanding this comment and another way of thinking about the yardstick. And as Elizabeth offered, our yardstick varies. And I think always helpful to know in a community of practice where that lands, if that feels acceptable or not.
Okay, another question for the county health rankings. How do you balance the goal of not providing any naked data with not imposing the researcher's own potential bias in interpreting the data?
So I think when we talk about no naked data, we are also talking about understanding that measures can be listed up in isolation of other data, qualitative or quantitative, that offers context. And of course, there's data collection bias that's happening all across the board that happens way before it gets to our space for interpretation. So I would just acknowledge that there's bias we're inheriting in addition to us imposing our own. But I think what we try to do to mitigate that bias is to, one, reflect and think really carefully and critically about what we understand about the broader context around a particular measure, and that we don't make decisions alone, that we seek expert advice and feedback from a broad range of people with different disciplinary backgrounds as well as lived experiences, so that we aren't, Elizabeth and I, as I would say, self-identified white women in an ivory tower, making decisions about what a particular data point means, but rather trying to do our best to bring forward the broader context that exists around that.
Yeah, I would definitely echo that. And I think that as researchers, we like to think that data is objective and that the data speak for themselves, and imposing viewpoints on the data feels wrong to us, right? But the reality is that data and results are actually inherently subjective, and there's a lot going on before that data even gets to us. And so if nothing else, acknowledging that and presenting your norms, your values, your subjective interpretation of that data, so that perhaps if someone doesn't necessarily agree with that viewpoint, they at least know what interpretation and subjective view you have put into that before presenting the data, just being very clear and upfront about that. And yeah, again, I would echo what Marjorie is saying, getting especially people who the data affects their viewpoint and subjective experience into that, because we might not know how they view the data or where their experience comes from. So just, yeah, getting a lot of viewpoints involved.
Dave, I see you nodding enthusiastically. Do you want to add to that?
I've seen this has come up very similarly in the differential privacy and the Census 2020 plans. I've talked a lot about privilege, right? So the Census Bureau has to make a decision, right? They have to decide what statistics are going to be more accurate and what are going to be less accurate, what geographic levels are going to be less accurate and what will be more accurate. And those are all fundamentally subjective decisions, right? Like the people can say, hey, I really care about cities and I want cities to be super accurate, but it's going to cause the towns or counties to be less accurate. That's a subjective thing. And so it's hard though, because like it feels like there's going to be winners and losers in that process, and that sucks, right? The decennial census is like a fundamental bedrock of our democracy, and if you're making these subjective decisions to privilege one thing over another, something about that just doesn't sit right with me. And I think that goes back to what Marjorie and what we were talking about, is just that but as long as the Bureau is transparent about the decisions that they've made, we can then use that to address potential inequities down the road. And so we have to push hard to make that decision-making process as transparent as possible.
Excellent. Elizabeth, can you talk a little more about deciding to use different data sources for overall estimates and disaggregated estimates? In your example, it was child poverty. Why not use the disaggregated source for the overall estimates?
Yeah, that's a great question. And so part of what we struggle with at the County Health Rankings is we cover all counties across the nation, both extremely large urban counties as well as extremely small rural counties. And so if we just use the disaggregated data source, which in this case was the American Community Survey, for our overall children in poverty estimates, there would be a number of small places with missing data for that overall estimate. And that kind of gets to the equity piece that we don't feel like it's as fair where possible if we can avoid having a lot of missing data for rural places. And so the other source I mentioned, SAPE, actually has coverage for all counties across the nation because they use a modeling procedure to inform their estimates. And so we felt like, because what we prioritize is county level estimates for all counties, and it goes into our ranking procedure, we wanted to have the most coverage possible for that value. And then the best we can do once we disaggregate is the American Community Survey. And again, still many counties and many races will be missing, but we feel like having at least some information there that we feel can be reliable is better than none at all. So obviously, ideally, both data sets would cover everything, but we are prioritizing coverage for that main overall measure.
Thank you. All right, any final questions for our presenters today? All right, seeing none, I'm going to say thank you again so much for these excellent presentations and the wonderful discussion. It's been really great. Oh, wait, did we get one last one in? Nope, just a thank you. So again, the recordings for the websites are available, or the recording for all these workshops are available on our website under past activities. And that's also where we'll post any additional workshops that we decide to schedule. Also, please, as a reminder, complete our post-workshop survey and let us know if there are any topics of significant interest to you and your group that we could maybe add or provide some technical assistance on. Again, these are our upcoming workshops. If you're registered, you've registered for all of them, and you can please feel free to join, and again, check back to see what other workshops we may add. Thank you, everybody, for joining, and I hope the rest of your Wednesday is really great. Thanks, everybody.
Thank you so much.